All set?
Yes, sir. All
Should we
set.
start?
Yes.
Okay, right. So good afternoon, everybody. Welcome to this afternoon episode of Pursue, and this is Pursue 5T. And we are continuing with our very important topic of neoplasia. This is the session 3. And we are streaming live from Kolkata. And we have with us Dr. Major Palash Kumar Mandal, who is a postgraduate from Calcutta and associate professor in pathology from Sagore Dutta Medical College, Kolkata. He is a lab director in the famous Desun Hospital and Heart Institute, Kolkata. And he will be continuing with our topic of neoplasia. Before I ask Major Mandal to take over, let me request all of you to please keep your mic muted, your camera off, and please don't share your screen. With this, let me request, sir, please share your screen and let's start. Thank you.
Good afternoon, everybody. Thank you, sir. So we carry on with our discussion on neoplasia. So Today we will be discussing chemical radiation carcinogenesis and microbial carcinogenesis as well. So depending on the time, of course, that's why I did not write microbial here, but my intention is to finish that thing first, and then I will go into the intricate details of multi-step theory of carcinogenesis, which is a little time taking, and you have to understand that thing. So I wanted to give the current details available with that, so I needed some time more, and so that lecture could be prepared. So that's why I shifted that lecture to the next session and preponed this lecture to this session. Well, these days what is happening, as you know, once the COVID risk has relatively come down, people are again, they have gone out merrymaking, the bars are open, the nightclubs have opened too. So the general scene is that this disease or the corona pandemic has gone away, which is not the scene. And with the vaccine having landed in Kolkata, so we are all the more happier thinking that we will be totally immune to the disease, the killer disease, the coronavirus. However, I should warn you that this disease is not an easy disease, because what the situation the people of England are facing right now, we might also be facing in coming months if we don't take enough precautions, and we let go our the protection thing which we had taken for these months. Okay, so that's on a lighter note, but we will be discussing our topics under these following headings: the carcinogenesis, the multi-step theory of carcinogenesis, chemical radiation carcinogenesis, as well as carcinogenic microbes and their mode of action, and subsequent the carcinogenesis through these microbes. Okay, so let us see how much we can finish today. The history of carcinogenesis is quite long, though it's showing only 1914, but the cancer was evident even before that, though it was may not have been there may not have been some published journals, published articles on that, but it was in 1914 Th. Boveri first found that chromosomal defects are an important thing for cancer to happen. So chromosomal defects, the defects in chromosome, otherwise it was thought initially some bacteria or some virus, though those have been also linked today, but initial theory was that some foreign microbes, they were the cause of cancer, which was gradually proved that main reason for a cancer or a carcinogenesis to happen is the chromosomal defect, or better known as some mutation in the genes, which was identified by Bauer, K.H. Bauer in 1928. And finally there have been so many theories, like Nordling, he proposed the one hit theory. Codson, he proposed the theory of two hit. It's actually Nordson. So Nordson's theory of two hit theory, and then further theories have been proposed. Some have been proved to be of little use. However, some theories have stood the test of time. That is, the two hit theory has been still quite valid. We have been that has been found to be valid, and there has been many more research, many more theories which have been propounded, but of course not have been accepted by the rest of the world. So with that, we go to the molecular basis of cancer, that is the Knudsen's two hit mechanism, which is the basis of the multi-step theory of cancer. And first, there are two things, that is, there is a non-lethal genetic damage to the chromosome, and then there is a clonal expansion of the single precursor cell with that genetic damage. So genetic damage has to happen. This is the primary thing. So chromosome was the chromosome was the site which was first detected by Boveri in 1914, that chromosomal defects lead to malignancy. That was further substantiated by various workers, and finally this two-hit theory of Knudsen, that is non-lethal genetic damage. The genetic damage should be there, but it should not kill the cell. The cell should survive. It should be that genetic damage that it is neither repairable nor will kill the host cell. So in that condition, the cell will have the capacity to divide. So the cell will divide with the genetic damage itself. So the progeny of those progeny from that particular cell will all have that genetic defect. All of these cells which will come after cell division from that genetically damaged cell will have that genetic damage. Okay, so that is the thing which is told in the second line, that is clonal expansion of the cell with a genetic damage. Now targets, we had told you that there are 4 classes of regulatory genes. This topic actually should have been taught before, but unfortunately I wanted this to elaborate a little more. That's why I am taking some time to make that lecture better for you. So that's why I am postponing that lecture. So before that I will discuss this particular part. So 4 classes of regulatory gene. One gene is the growth promoting proto-oncogenes. Second group is the tumor suppressor gene. Third group is the genes regulating apoptosis, and fourth is the genes involved in DNA repair. These are the 4 important classes of regulatory genes which regulate the cell cycle. Regulatory genes means the genes regulating the cell cycle. We are only interested in cell cycle because the cell cycle is the area where the cell proliferation takes place. Without cell cycle, the cell will not go into division. There will be no cell division and there will be no proliferation. So if there is no proliferation, no risk of malignancy. But this is the place where the problem happens. Dividing cell, damaged cell which is dividing, that is the crux of the issue. Okay. So now what basically, this is a common theory which is there. There is a normal cell and there is a DNA damage which is happening to the normal cell. How does DNA damage happen? Through various things. One of them is through chemicals, through viruses, through radiation, and even all the chemicals we are inhaling. There are many chemicals which are known as carcinogens we are eating. So through the system, the chemicals are entering our blood, and these chemicals, they are landing into our cell, okay, through the blood itself. So now once these chemicals are reaching at the cellular level, they start their action of damage. So they, by some mechanism, go and try to damage the gene itself, damage the chromosome itself. So once the chromosome gets damaged, there is some change that is called mutation. So that mutation or that DNA damage in most cases is either successfully repaired, or if there is a failure of DNA repair, so there is a, what happens there? So then that failure leads to the mutant gene. So that mutant gene, if it is there in the genome of a particular cell and it is detected by the DNA repair gene, so DNA repair, it is not detected by the DNA repair gene or gene, then there is a second step called apoptosis. So alteration in the gene leads to apoptosis if the repair is not successful. However, this mutation has a deleterious effect. This deleterious effect is what? There is activation of growth promoting oncogenes. This mutation leads to some activation of the growth promoting oncogenes. So there are this growth promoting oncogenes are there. These are proto-oncogenes for all normal persons. For all of us, these growth promoting proto-oncogenes are present. For all of us, tumor suppressor genes are present. For all of us, genes regulating apoptosis are present, and genes involved in DNA repair are present for in all human beings. Okay, so these proto-oncogenes, whenever they are mutated and they lead to cancer, that particular gene is known as oncogene. Proto-oncogene is in normal person, oncogene is in person who is harboring a cancer. So the same gene which was there as a growth promoting gene in a normal cell cycle becomes a proto-oncogene, and it does not get inhibited by any inhibitory signals, and it propagates cell cycle on its own like an autocratic ruler and destroys everything, leading to the malignant growth. Okay, so that is the danger. So proto-oncogenes, once they are converted into oncogenes, that is the danger. How they are converted? Again by the same mutation. So mutation is the thing which leads to this development of oncogenes. So mutation where? Mutation in those proto-oncogenes only. RAS is a proto-oncogene, MYC is a proto-oncogene, cyclin D is a proto-oncogene, and the mutation in those particular genes, they lead to oncogene formation. Okay, so the activation of proto-oncogenes lead to the formation of oncogenes. So they lead to the growth promoting oncogenes, activation of oncogenes, and simultaneously they do what? They inactivate the tumor suppressor genes. So growth promotion is activated, growth inhibition is stopped. What will happen? There will be excessive proliferation of cells. What cells? The genetically damaged cells. The cells which will eventually lead to a malignant disorder. Okay. Also, they will also suppress the apoptotic genes. Apoptotic genes, if they were successful in executing their action, would have killed the cell at the initial phase only. They would have killed that genetically damaged cell, but that did not happen because this mutation in the genome started its detrimental action through this particular way. Okay, please be clear about this thing. This is the basic mechanism for any malignancy. For any malignancy, whether be it a chemical carcinogenesis, whether be it a viral carcinogenesis, this particular flow chart is very, very important. Okay. Now, what follows? Now, activation of growth promoting oncogenes, inactivation of tumor suppressor genes, and alterations in genes regulating apoptosis. So, eventual thing is that the clonal expansion of the damaged cell, and there is progression of the tumor, but after additional mutations are happening. It is not so simple. One mutation leading to a cancer, it does not happen so easily. Okay, so one mutation cannot do all such activities by its own. There has to be additional mutations. That is why the two-hit theory. Two-hit theory means actually it's a multiple hit theory. So multiple hit theory means there is a genetically damaged cell from the beginning. Beginning means after acquisition of the genetic damage through some effect like radiation, virus, and etc. etc. After that, there is second genetic is supported by angiogenesis. There is a growth of blood vessels which provides the nutrition to the tumor, and additional mutations keep on uh, happening, which will eventually lead to the destruction of the DNA repair gene, destruction of the apoptotic genes, and eventually promotion of these only growth promoting oncogene. So only one person, that is on the left, that fellow is surviving. That is the growth promoting oncogene. That is the oncogene, that is the growth promoting proto-oncogene being converted into oncogene, which is surviving. Others are almost either inactive, or those are they have been destroyed. Am I clear? So eventually the tumor is progressing gradually, and making its all the characteristics which are needed for a malignancy to form, and then there is a metastatic clone which develops, that goes to different areas, and ultimately the host is killed. Fine. So this is in a nutshell. So this is a multi-step theory at both phenotypic and genotypic levels. Okay. So multiple subclones are developed because the mutation leads to a malignant neoplasm, and from that multiple subclones do develop. Some subclones have the propensity towards metastasis, some subclones have propensity towards local invasion, some subclones are resistant to certain forms of chemotherapy or radiation therapy. So those subclones they develop, and they lead to the survival of the malignant neoplasm and eventually compromising the host. Clear? So this is the picture which has been given in the Robbins, the multi-step theory, the famous adenoma carcinoma sequence. What happens? The mucosa and the submucosa in a colon is just, this is the normal colon. Okay. So now there is a germline or inherited or acquired somatic mutation of the cancer suppressor gene. Okay. Cancer suppressor gene. So that is the APC, adenomatous polyposis coli gene, located at long arm of 5th chromosome to 1. Okay. So this particular location, locus, is the locus for APC gene. If there is a mutation either inherited or acquired, that is the first hit. Now the mucosa becomes at risk. Initially it was a normal mucosa. The mucosa becomes at risk. Then there is some other abnormality, that is some other genetic abnormality that take place, and there is inactivation of the normal alleles. That is the second hit theory. So that is done by the beta catenin. So mutation of those beta catenins. Okay. Now there is some proto-oncogene mutation. Proto-oncogene we have already discussed. You have to refer back to the same 4 classes of genes. You have to remember that 4 classes of genes, the classes of oncogenes, the second class of the tumor suppressor gene, third class of repair gene, and fourth class of apoptotic gene. The 4 principal classes you have to remember if you have to understand this multi-step theory of carcinogenesis. So now this second step, the proto-oncogene mutation takes place. That is RAS, I told you. Okay. So RAS was there, cyclin D1, RAS, MYC, they were the proto-oncogenes. The proto-oncogenes, once they gets mutated, they become oncogenes. Okay. So once they become oncogene, they lead to the development of a tumor. This is a tumor formation. This is a, see, this is a polyp-like area. So a polyp is formed, which is still adenoma. That is a benign polyp has formed. However, if there is a wild type P53 mutation, P53 mutation leads to oncogene induced senescence. Okay. So if there is a wild type P53 mutation, so oncogene induced senescence takes place. That means the person is saved. However, if there is a homozygous loss of additional tumor suppressor genes, overexpression of COX2, that is P53 is a tumor suppressor gene. So P53, if there is a mutation in P53, loss of heterozygosity at this long arm of 18th chromosome, that where the SMAD2 and SMAD4 reside, those lead to eventually progression towards malignancy after additional mutations have taken place. So many mutations are needed. Okay, just one mutation or two mutations are not going to bring about a full-blown malignancy. So that is the multi-step mechanism. Initially it was the one-hit theory, then came the two-hit theory, then came the multi-step mechanism. So every step there is some mutation which is happening, and eventually so many mutations are necessary for a malignancy to happen. Okay, so there are multiple checks and bounds in the body itself, but a malignant tumor is so clever, it tries to circumvent all the checks, all the bounds on gates, and crosses every barrier to make its to achieve its goal, that is to make a full-blown cancer. Okay. So, well, coming to the chemical carcinogenesis, whatever things you are seeing, the good things in life, so called, so all of these have been found to have carcinogens, all of them. The trans fat which is present in all these fast foods, and this monosodium glutamate found in even the Chinese food items, the smoke, the alcohol, everywhere there is some carcinogen which is hiding inside. Okay, so it is a well-known fact, and since you are all belonging to the medical fraternity, you are all well aware of all these things. Even a layman knows these things better, but the main thing is to resist the temptation. That is the crux of the story. So you have to avoid these all the good things in life to remain healthy. But the last day that we were discussing, even if you abhor from all these things, if you live away from all these things, even then mutations may happen, but the chances are less, definitely. Otherwise, why will you say avoid this, avoid that? If the risk factor is the same for a person who is taking and avoiding, then why avoid? Have it. No, the risk factor is definitely much less. But yes, if it has to happen, it will happen, but the chances are very low. But if you indulge in all these activities, especially smoking and alcohol and all these things in heavy amounts, and the fast food, if you are a regular a habitual taker of these fast foods, then be careful. So the first evidence of a chemical carcinogenesis was detected by a British person called Sir Percival Pott. So what he detected was that the persons who were cleaning the chimneys, you see there were the chimneys in the old days, even today the chimneys are there, but mostly in the cold areas like Kashmir, Darjeeling, those areas they have the chimneys. So those fireplaces, so the persons who used to clean the chimneys, they had some scrotal cancer. So it was detected. He he tried to analyze why these people only develop scrotal cancer. So it was found out that the soot, the chemical which is there, the blackish chemical which is there in the chimneys, that had some relationship with the development of scrotal cancer. Okay. So that was the first evidence. So the evidence-based medicine, as we say today, so first evidence what he found was the chimney soot was leading to development of scrotal cancer. So now the list of chemicals which are leading to cancer is a big list. I don't want to name all of them. So all this, there is direct acting carcinogen, there is pro-carcinogens that require metabolic activation. So all these names are there. So you can read it on your own. But there are many more than even others are there which may not have been included here. So all these things are present. Okay. Chemicals, steps in chemical carcinogenesis. There have been many models, and one model is a mice model skin cancer. So mice model skin cancer is that there were multiple groups which were selected. Okay, so the group 1, there was no cancer was detected. In the group 2, so there was a application of promoter. The croton oil was there. Okay, and in group 1, application of initiator. So this theory says that there has to be some initiator which will initiate the process, because again we go back to the same thing, the multi-step, that is the stepwise progression of malignancy. It does not happen like that. If one fine morning a person cannot have a cancer, the genetic change cannot be full blown in one day only. So it has there for a long time. So gradually that gradual happening is not detectable from the outside. Okay, so that from the very beginning, if we can see, the first thing is that there is some initiator, someone which will initiate the process, some chemical which is initiating the process. So they have identified one such initiator as polycyclic hydrocarbon. So the X indicates a polycyclic hydrocarbon. So if you just apply polycyclic hydrocarbon to a mice or a group of mice, so there are no tumors which were developed. Okay, so the group 2, they applied the initiator, that is polycyclic hydrocarbons, as well as they applied some promoters, that is the croton oil. So once the promoters were applied, after the initiator, the tumors happened. In group 3 also, they applied the initiator, waited for some time, then applied the promoter. In that group also tumors happened. Now they reversed the pattern. So they applied the promoter first, that is the croton oil first, and then they applied the initiator. There was no tumor, only promoter, no tumor, and finally it was seen that if you apply a promoter, initiator, and apply the promoter at long intervals, even then there was no tumor. Okay, so also it was seen that in some people or some mice, the age, sex, nutritional status, all these determine the internal dose of toxicants produced, and hence influence the risk of cancer development in a particular individual. So that was the gist. So it was seen that there is a promoter, a initiator, and there is a promoter. Without any one of these two, there is no cancer formation in the chemical carcinogenesis. Okay. So this step has been given in Robbins. So a carcinogen leads to metabolic activation. So metabolic activation leads to formation of some electrophilic intermediates. Okay. Now if it is detoxified, this carcinogen is detoxified, it is excreted. Okay. So many chemicals, they enter our body, they may be detoxified and they don't cause any harm. The electrophilic intermediates, they are the dangerous thing. Why? Because they can directly bind to the DNA. So a large molecule cannot reach the DNA, so it will not be that harmful. But if it becomes converted into electrophilic intermediate, like the charged intermediate subsidiaries, those can cross the plasma membrane, go into the cytosol, and eventually go into the nucleus, reaching the DNA. Okay, so they can bind to the DNA directly. Those are the electrophilic intermediates of all the chemicals which we are talking about. So even those intermediate electrophilic intermediates can be detoxified by the body's own system. So if it is detoxified, nothing happens, they are excreted again. But if they are not detoxified, so this leads to the initiation process. The initiation process is that those electrophilic intermediates will go and bind to the DNA and lead to something known as adduct formation. Adduct formation. This adduct formation is the risk factor. Okay. So this adduct formation is the risk factor. Why? Because if the DNA repair genes are active here, so that will either there will be the normal cell, it will become a normal cell again, because the DNA has been damaged. By whom? The electrophilic intermediates. They have gone and bound to the DNA, the normal DNA of a cell, and they have damaged the DNA. Now the damaged DNA either needs to be repaired, or the damaged cell has to be eliminated from the system. So this is what is happening here. You see, either DNA repair is happening, which leads to the normal cell, which revival to a normal cell, or else if the DNA repair is unsuccessful, the apoptotic gene comes into picture. The pro-apoptotic gene, that is, comes into picture, and that leads to cell death. Okay, cell death. Now, if the DNA repair is unsuccessful, cell death also does not happen, then there is a permanent DNA lesion which is known as the initiated cell. Initiated cell, this means the cell has been permanently damaged, but the damage is sublethal. It has not killed the cell. Am I clear? So this becomes initiated cell. So here you see the application of initiator led to a initiated cell. However, only initiation will not lead to tumor formation. Okay, so you need a second step as well. So this initiated cell starts proliferating. So altered differentiation takes place. This altered differentiation, due to some other mechanism, by some promoting action by another chemical, leads to the pre-neoplastic cone. So this initiation and followed by promotion. Promotion means there is some second hit. Initiation is the first hit, promotion is the second hit. So second hit leads to the formation of a pre-neoplastic clone, and the pre-neoplastic clone keeps on proliferating, and there are some additional mutations which are happening, ultimately leading to a malignant neoplasm. Okay, so all these are important. You see, one hit, one just initiation or one just promotion is not enough for a malignant neoplasm to happen. So the steps in chemical carcinogenesis shows clearly that there should be an initiation followed by a promotion, and multiple genetic damages have to happen through the carcinogen itself, the carcinogen's action, the multiple hits have to happen. Okay, so this is another picture which shows the same basic principle, that a carcinogen exposure leads to absorption of the carcinogen, and there is a tissue distribution and metabolism, biotransformation, and initially there is non-genotoxic events, inflammation, immunosuppression, reaction, reactive oxygen species generation. All these are generation and leading to altered signal transduction and genetic damages. So these genetic damages lead to hypermutability, genetic instability, uncontrolled proliferation, escape from apoptosis, and leading to cancer. So this has been elaborated a bit, and this is but the basis is that there should be a hit that is initiation. There should be another hit, that is promotion, and within these promoting hits there are multiple mutations which are happening, not one. Okay. So you see, the first line which is there is very, very evident. DNA is the primary target for chemical carcinogens. Its DNA is the primary target for all carcinogens, okay, not the chemical carcinogen alone. And the mutated, there are some oncogenes, there are some tumor suppressor genes. So oncogene is a RAS here, and an example of a tumor suppressor gene is P53. Okay, so now carcinogen altered cells may undergo at least one cycle of proliferation so that the change in DNA becomes fixed. This is very important. So one cycle of one cell cycle has to be completed. That genetic damage has to go to the next progeny. So at least from one cell, if two daughter cells are produced, so those two daughter cells should have those altered chemical configuration or genetic configuration. Okay. Now agents which do not cause mutation but instead stimulate the division of mutated cells are known as promoters. So promoters come second, next. Okay. They have not caused a mutation, but they are just leading to the proliferation of the mutated cell. They may be leading to stoppage of apoptosis, may leading to obstruction of the DNA repair, and leading to the promulgation and promotion of the mutated cell cycle. Okay. And they may be biologic agents such as viruses, parasites, dietary factors, hormonal influences. So many things may act as promoters. Some initiators are non-tumorigenic. Okay, you see, that is what the mice model showed. Only if you put the initiator, that will not lead to tumor formation. Application of promoters lead to proliferation and clonal expansion of the mutated cell, and the initiated clone of cell suffers additional mutation. Same thing which has been there, which we have just discussed, lead to eventually a malignant tumor. So you see, this is a very old and known theory of that the carcinogens which have after some atomic explosion, whether be it a man-made atomic explosion like this incident, that dropping of this bomb at Hiroshima and Nagasaki in Japan by the Americans, or some accidental damage to the nuclear reactor which happened in Russia like Chernobyl. So these have led to the radiation damage and radiation exposure to lots and lots of people. This bomb, the atomic bomb, killed so many people, and it also led to the carcinogenesis in another large number of population in Japan. Okay, this was proved after so many years. And the radiant energy, radiation carcinogenesis, what is that? What we are discussing right now, the ultraviolet rays of the sunlight or the ionizing electromagnetic and particulate radiation, they act as carcinogen. Okay, so any radiation, whether be it that ultraviolet rays or the radiation coming from the this X-rays, CT scan machines, and the radiation for the patients who are there for radiotherapy, all these are they can lead to cancer. So ultraviolet rays, what do? They are associated with increased incidence of squamous cell carcinoma, basal cell carcinoma, and even melanoma of the skin. The degree of risk depends on the type of UV rays, the intensity of the exposure, and the quality of the protective mantle of the melanin in cell. So melanin layer, so the dark skinned person are more protected than the fair-skinned person. Understand? So the basal cell carcinoma, squamous cell carcinoma due to radiation happens more in fair-skinned people. So what does ionizing radiation do? It leads to some again genetic mutation. The main thing is that the radiation directly leads to genetic mutations, genetic damage. So initially, if the genetic damage is so severe that the cell will die, then nothing happens. So the person who comes for radiotherapy, so the person, the doctor or the radiation oncologist aims to kill the malignant cell by direct application of the radiation. Okay, so the radiation should be targeted in such a way that goes directly to the malignant tumor and kills the tumor cells. That is the target based radiation. Now what happens is that if there is radiation to a non-tumorous cell, the non-tumorous cell, that is a normal cell, that may also die. That is in colloquial term or a normal terminology called collateral damage. Understand? So again I give you a example from the army. Like two countries, if they are in war, one country attacks another country and drops a bomb in a army establishment, many civilians may be killed. Okay, so many civilians who are innocent civilians who are not involved in fighting of any kind, they may be killed. So that is called collateral damage. Innocent women, children, and so many people who are not involved with the army may be killed. So that is called collateral. Here also this collateral damage happens if the radiation kills the normal cell. So the targeted therapy aims to kill the tumor cells only, but the non-tumor cells may be killed. So that is one way the cells can be permanently destroyed and they may be killed. So now second thing what happens is that this radiation can lead to mutation, and that mutation may be a non-lethal mutation. So non-lethal mutation is the damaging factor. If it was a lethal mutation or a lethal damage, the cell would have died and eliminated from the system through the process of apoptosis. However, if there is a non-lethal genetic damage, non-lethal means it does not kill the cell, but the genetic damage remains. That is the problem. So everywhere that non-lethal genetic damage, you have to remember this thing very clearly. A non-lethal genetic damage is the basis of carcinogenesis. Okay, so that non-lethal genetic damage, it leads to multiple further mutation and eventually neoplasia happens. So it has been seen that X-ray workers, they may suffer from leukemia. Radioisotopes from the radiation can lead to various type of this radioisotopes which are used in either research or in some treatment. They may lead to thyroid cancer, and atomic explosion can lead to skin cancer, leukemia, and so many other things, even thyroid cancers. Okay. Ultraviolet rays non-melanoma skin cancers are associated with total cumulative exposure of UV radiation. So UV radiation which comes from the sunlight or through other sources, people who are exposed, so they, in their body there is a cumulative exposure, means there is this radiation that keeps on accumulating. That is, the damage keeps on accumulating. Gradually it is accumulated, and melanomas are associated with intense intermittent exposure like in sunbathing. Okay, so non-melanoma skin cancers are what? Squamous cell carcinomas, basal cell carcinomas. So that happens with total cumulative exposure, total exposure to UV radiation, whereas melanomas occur due to intense intermittent exposure like in sunbathing. Okay, the UV portion of the solar spectrum, there are three ranges: UVA, which is this nanometer, 320 to 400, UVB 280 to 320 nanometer and UVC 200 to 280 nanometer. So now UVB has been found to be responsible for induction of cutaneous cancer by formation of pyrimidine dimers in the DNA. So not all ultraviolet rays are damaging, but this UVB type is the one which is responsible. We may not be able to see which one is B, which one is A or C from outside. So it is better to protect oneself, to better to take enough precaution so that we are not exposed to ultraviolet rays and thus harm our body. So radiation may affect our body in various ways, and even the mobile phone radiation that has been seen to penetrate the brain, and it may lead to so many things. So radiation is not a very good thing, and more the technological advances are happening, the more we are exposed to all these effects of radiation, effects of chemicals and so many things. And ionizing radiations are what? Ionizing radiations are electromagnetic radiations, and particulate radiations are what? These alpha particles, beta particles, proton, neutrons, all are carcinogenic. Okay, and all have been found to be in the survivors of those atomic bomb explosion dropped in Hiroshima and Nagasaki in Japan. Okay. Initially, there is a marked increase in the incidence of leukemias, that is the AML and the chronic myeloid leukemia, after an average latent period of 7 years. After 7 years only, these leukemias they started developing, and subsequently many solid tumors with a longer latent period, colonic cancer, breast cancer, thyroid cancer, lung cancer was found to be increased in those populations. Such a serious thing. The bomb not only killed the people instantaneously at that point of time, but also led to the death of so many people even after the passage of the bomb explosion, so many years after the passage of bomb explosion. So radiation carcinogenesis, so there are more than one theory on the mechanism, and evidence suggests that genes such as oncogenes and anti-oncogenes are implicated. So these models are same. Let me tell you briefly, all the models, if you can think, they are almost the same. That is the multi-step theory. So there is one hit, there is another hit, there is another hit and another hit. So multiple hits are happening. What are those hits? Multiple mutations are happening. Okay, so the same thing, the initiator promoter sequence or the multiple hit theories, they all lead to the basic fact is that one non-lethal genetic damage is happening, which is propagated to the next generation after a cell cycle and gets stabilized there, and after it gets stabilized, it leads to some blocking of some good genes, that is the DNA repair gene, the apoptotic genes, those are stopped, and the growth promoting oncogenes which become oncogenes, growth promoting proto-oncogenes which become oncogenes, they are promoted. So the oncogenes, that is the growth promoting genes, they are promoted, and the repair genes and the apoptotic genes, they are stopped. The tumor suppressor gene, they are stopped or inhibited. So that is how this carcinogenesis keeps on propagating, and eventually that is the crux of the whole issue. Okay, so you think very logically that the whole mechanism of carcinogenesis is just two. One is the initiation and one is the promotion. Initiation is the first hit, promotion means multiple hits. It's not just one, multiple hits are necessary to eventually make a cancer successful. So I think the time is over. I don't want to cross the time limit, because again microbial carcinogenesis is there. It will take some time. I thought I will be able to finish it off, but let me take it into the next class so that it is easier for you all to understand. So we will discuss the viral the microbial carcinogenesis, and along with that the we will dwell more upon these four category of genes which we are discussing, and how each gene is converted into the into the proto-oncogene to oncogene, and how these other good genes are silenced. So we will discuss more on this in the next class. Okay, thank you so much.
Thank you, Dr. Palash. Wonderful presentation, and absolutely rightly said that it's the two-hit theory which actually works in most of the places. Now we have various classifications based on two-hit, especially the lymphoma classification. And and you have, as usual, flavored the entire presentation with so many events which are happening on a day-to-day basis. And what you rightly said in the beginning is that COVID definitely has not gone, and all the merrymaking still should be controlled. So the next session will be the continuation of this.
Yes, sir.
Fine. Thank you so much. God bless you. Take care. Bye bye.
Thank you, sir. Thank you all of you.